Household contact in tuberculosis. Now I am going to discuss on epidemiology, risk factor, screening and diagnostic protocol, preventive treatment, public health intervention, challenges and future perspective. So let's start with the household contact in tuberculosis. As you know, tuberculosis remains a global health challenge with household contact, that HSC, being at high risk of infection and disease. WHO, World Health Organization, estimates that 50% of household contact, that is HHC, of active pulmonary tuberculosis patient develop latent tuberculosis LTBI, and 5 to 10% progress to active disease. So the objective of this talk is to discuss the epidemiology, risk factor, screening, diagnostic protocol, preventive treatment and public health intervention with challenges and future perspectives. So first is the epidemiology of household contact. Global burden. WHO reported 10.6 million new TB cases in 2022, with India, China and Indonesia contributing to 50% of the load. Transmission dynamics. TB is an airborne disease spreading through the droplet nuclei. From coughing, sneezing or speaking from a patient of sputum positive, household contact have a continuous exposure, leading to higher infection rate than the community contact. Incidence among household contact, active TB is 3 to 5% of household contact develop active disease within 2 years. Latent TB infection, LTBI. 50% of the adults of a household contact have latent TB infection. Children less than 5 years are at higher risk because of rapid progression to severe TB, that is a miliary or meningitis. Risk factor for TB in household contact. First is a host factor. Age. Infants and elderly are more susceptible. Immune status. HIV positive, uncontrolled diabetes, severe malnutrition and immunosuppressive therapy increase the risk. Now the nutritional deficiency. Vitamin D deficiency has been linked to increased TB susceptibility. Environmental and social factors. Now in environmental factor, prolonged exposure, in which crowded living condition, poor ventilation and in socio-economic status, first is a poverty, poor healthcare access, smoking and alcoholism, which increase TB progression risk. Index case factor. Smear or sputum positive tuberculosis, higher transmission risk, cavitary TB, more infectious than non-cavitary disease, multi-drug resistant MDR TB. It requires special consideration for prevention and treatment. Third is a screening and diagnostic protocol for household contact. First is the objective of is to identify acute TB and latent TB, that is LTBI, early to prevent disease progression. Screening approach. First step is identify household contact of a sputum positive or a TB case, which is called index case. Step 2 is a classify as high risk, that is a children below 5 years, immunocompromised, elderly patients, elderly people, and low risk, adult with no comorbidity. Diagnostic test for active TB or pulmonary TB. First is a symptom screening. Cough more than 10 to 15 days or 2 weeks, fever, significant weight loss, night sweat. Second is a chest X-ray, primary tool for asymptomatic household contact. Third is a sputum test, nucleic acid amplification test, gene expert, smear microscopy. Fourth is a tuberculosis skin test or IGRA for latent TB diagnosis. Now the key guidelines, WHO and India's National TB Elimination Program. All household contact must go systemic screening and follow for 2 years. Fourth is a preventive treatment. TB preventive therapy, that is a TPT, is recommended for latent TB infection positive household contact. So the WHO guidelines recommends isoniazid, that is INH, for 6 to 9 months, or rifampicin plus isoniazid, that is INH, for 3 months, that is it is called short course. Bedaquiline for MDR household contact is in experimental, and children below 5 years and HIV positive contact should receive TPT regardless of LBTI. Public health intervention. First is a contact tracing and active case finding. Second is a community-based program to identify symptomatic and asymptomatic TB cases. Vaccination, that is a BCG, Bacillus calmette-guerin. BCG vaccine provides partial protection against severe tuberculosis in children. Nutritional support. Malnutrition worsens tuberculosis progression. Nutritional supplementation program, for example, Poshan Yojana in India, are crucial. Now, airborne infection control. Improve ventilation, ultraviolet germicidal eradication, N95 for high risk groups, strengthen healthcare systems. training primary healthcare worker for better TB screening and patient management. Challenges in tuberculosis household contact management. First is a low screening coverage. Many TB cases are missed due to lack of awareness. Second, poor adherence to preventive therapy (IPT), long treatment duration and drug toxicity lead to high dropout rates. Third is a multi-drug resistant TB (MDR TB). Standard prevention regime do not work for MDR TB contexts. Socio-economic barrier, TB stigma, financial constraint. Fifth is a healthcare system gaps, limited resources in low income settings, future perspective and innovation, shorter, safer TPT, tuberculosis preventive therapy regimes, research on 1 month rifampicin INH regime, point of care diagnostic, digital based or AI based chest X-ray interpretation, portal gene expert ultra, TB vaccine in development, new candidate like MTB VAC, M72 or ASO1E in phase 3 trial. Digital health, mobile app for adherence tracking, virtual counseling, community engagement, strengthening awareness program, anti-stigma campaign. So, in conclusion, household TB contact represent a high risk group requiring urgent attention. Early screening, preventive treatment, and public health intervention can significantly reduce tuberculosis transmission. Collaboration between government, researchers, and community is the key to achieve TB elimination by 2025 and in India and 2030 in WHO and TB strategy. Call of action. Healthcare providers should actively screen all household contacts and ensure treatment completion. Public health policymakers should strengthen contact tracing program. Community must break the TB stigma and support affected family. Thank you.